Setting up your private practice? Don't miss these essential admin tasks for anaesthetists. Hi, I'm Ben Dudley, Managing Director of Zento. If you're an anaesthetist here in Australia and thinking about setting up your own private practice, you've probably realised there's a lot more to it than just getting your first private list. There's a seemingly overwhelming list of admin tasks that need to be sorted before you can start working. And if you don't get these things right, you could be setting yourself up for some serious legal and financial issues down the line. So let's break it down. Here's a checklist of essential admin tasks you need to tackle before you start your first private list. These are the things you can't afford to overlook. Trust me, I've seen a lot of doctors run into issues that could have been easily avoided had they set things up properly from the start. First off, you'll need to register for an ABN, your Australian business number. This is your business ID, and without it, you can't legally operate your practice. Make sure this is done early on and that you select the correct entity type. You might want to seek some professional advice on this one. Setting up your banking is another important step. Whilst it does not need to be a formal business bank account, you'll want a bank account for your private practice that keeps it separate from your salary, groceries, and other personal items. This makes it easier to manage your finances and ensure everything's in order come tax time. I'd recommend also setting up an account just for your GST and tax obligations, so you can put money aside to make sure you're not caught off guard when those payments are due. Next, ensure your registration with AHPRA is up to date. This is your license to practice, and you need it to have all your details in order before you start working privately. You'll also need to register with Medicare through PRODA and obtain your provider numbers. It is good practice to have a separate provider number for each location you plan to work. This will be helpful for billing and ensuring you get paid. Then, you need to get credentialed with the hospitals where you'll be working. This process can take some time. You will need to provide supporting documentation, and you'll need colleagues who can vouch for you in your application. So it's a really good idea to start this early and find out what the process is for each hospital. Next up, you'll need a system for managing lists, patient records, and billing. A good system will help you know whether you're being paid for all the work you do and keep records for your BAS. Whether it's AHPRA, the private health insurers, or Medicare, keeping good records can also help you in the unlikely event you're audited. Then, there's setting your fees. This ties into the agreements you enter into with the private health insurers. Make sure you understand what the different agreements mean and how these affect your income, as well as the potential out-of-pocket amounts for your patients. There are a couple of videos in this channel that go into more depth on these topics, so make sure you watch these too. Don't forget to establish patient payment methods: direct bank transfer, BPay, credit card payments, even cash. Whatever works best for you. This will allow you to collect payments smoothly and efficiently from the start. You'll also want to plan for your continuing professional development or CPD activities. This is an ongoing requirement to maintain your AHPRA registration, so it's important to have a plan in place from the start and allow sufficient time for the activities so you're not panicking at the end of the year. And last but not least, setting up your patient communication channels. This could be anything from email to secure messaging systems, making sure you're reachable and professional in your communications. You'll also need to establish reliable communication with surgeons' rooms and other third parties to make sure everything runs smoothly, from scheduling lists to managing billing and follow-up care. We've covered a lot in this video, and I know it can feel overwhelming. This is a really broad overview of everything that needs to be set up when you're starting out your own private practice. We understand there's a lot to think about, and we have more videos coming that dive deeper into each of these setup and admin tasks in more detail. So if you found this helpful, make sure you subscribe to the channel and keep an eye out for updates. And if you have any questions or need some guidance, feel free to contact Zento for obligation-free advice. We get you, and we're here to help.